Hi there. Welcome, everybody. Coming back here to another episode of Laughter Through Tears, the 120 podcast. I'm your host, Jackie Duda. I'm a septic shock survivor almost 5 years ago now, coming up in this month, actually, in May. I developed a colon perforation from undiagnosed diverticulitis and got me sent via helicopter straight to a trauma center in Baltimore. I live in central Maryland. It was like 75 miles away, and they had to get me there fast. I also have Ehlers-Danlos syndrome. I suffer from POTS and Crohn's disease and osteoporosis. So I've made this podcast about everything sepsis, chronic illness, and disability because they all kind of overlap, really, if you think about it. People with chronic illnesses, all 129 million of us in the country, in the U.S., for those of you who are listening from other countries. So there's 129 million of us with chronic conditions in the United States alone. And we suffer side effects and problems and, use medical devices and things that sometimes make us more susceptible or higher risk for sepsis. And people with disabilities, of course, are at higher risk for sepsis. So I figured, why not? We're going to discuss all three topics. And this also happens to be May, which is Ehlers-Danlos Awareness Month. And so we are also trying to help raise awareness for this syndrome, which we're going to talk about in just a minute. So anyway, I met my guest today, Katherine Perry, on Instagram several years ago. She is under the name Katherine Perry Music, and I got acquainted with her situation and her struggles with EDS. And it was most likely during one of those big EDS awareness pushes in the month of May. And I was doing like the walk and roll challenge and, all these things. And we were all trying to help, raise awareness about this syndrome. Anyway, so as patients and advocates, of course, Katherine and I, we immediately clicked, and as many people with rare diseases and these conditions do. And we build a little community around that. Katherine is also, let me tell you, a very talented artist. And she even wrote and produced a song about living with Ehlers-Danlos syndrome. It's aptly titled Disjointed. And you're going to understand why that title means something in a minute. Anyway, her music can be found on Spotify. And right here on YouTube, she has a YouTube channel at Katherine Perry Music, so make sure you go over and subscribe. She is truly an Ehlers-Danlos chronic illness warrior. She tries to find the positive amidst the 24/7 battles of living with a chronic illness, while also raising her family and trying to make the most out of life. Katherine, I want to thank you for coming on the podcast today. I am so excited to talk to you about this very important topic of Ehlers-Danlos syndrome and your music too, of course. So welcome.
Thank you so much for having me, Jackie. It's so nice to actually speak to you kind of face to face.
Yeah, we're in real time
instead
of messaging on our DMs and everything. And Katherine and I talk about everything. I mean, if there was ever a wonderful person to commiserate with, Katherine is that person. So thank you so much. And I thought we might get started by, if we just discuss for the audience's sake, those who don't know what Ehlers-Danlos syndrome is.
Yeah, well, I guess let's start by differentiating that there are either 13 or 14 different types of Ehlers-Danlos syndrome. And the most common type is hypermobile Ehlers-Danlos syndrome, which is what you and I both are living with. So I'm going to speak specifically about that type because that's the one that I know the most about. There are others like vascular and
classic.
Yeah. So with hypermobile Ehlers-Danlos syndrome, the name is kind of self-explanatory in that we have hypermobility, which just means that our ligaments don't hold. Yes, they don't hold. Like
mine used to go like all the way past my forearm.
I know we're not supposed to do these party tricks, but I know I'm not going to hurt myself. Like I'm not pushing beyond. Right. Anyway, we're extra bendy. But that's not just in our joints, that's also in all of our connective tissue, and we are affected by this multisystemically. I have issues, with gastrointestinal problems, with body-wide inflammation, which includes our brains, and causes things like brain fog, headaches. We have issues with our vascular system, many of us. Many of us deal with issues with breathing, with immune function. It's difficult to figure out for doctors as well, because our medical system is so siloed. And so, you'll go and see one specialist for one issue and another specialist for another issue, but none of them are communicating and putting all of these puzzle pieces together to recognize, wait, this is this is one thing causing all of these things that are happening.
Yeah. And it's a genetic thing, right? Like, it's a genetic defect in our collagen, and you have collagen all throughout your body. Collagen is holding us together, or it's the stuff that helps the ligaments to hold us together. It's everywhere. And that's why, as Katherine described, it can affect you head to toe, literally, and in your organs. So,
right.
Yeah.
Yeah, that's a very brief, quick overview.
Yeah. And we'll also put in the description box, I'm going to have a link to the Ehlers-Danlos Society, of course, which is an international nonprofit that does a great deal of awareness, education, and support for those of us with EDS. And also with the listing of those 14, I think it is 14 now, subtypes, because I think they discovered another one. And they can genetically test for most of them, right? There's question whether they're developing or have developed a genetic or located a gene that can identify if you have hypermobile Ehlers-Danlos, the type that we have.
Right. As of right now, there's no testing with like blood or anything else that can definitively diagnose hypermobile Ehlers-Danlos syndrome. Right now, it is strictly a clinical diagnosis, which means there's criteria for, something called the Beighton score, where they test to see if certain parts of your body move in a certain way and are extra flexible. But you have kind of this list of criteria that you have to meet in order to receive that diagnosis of hypermobile Ehlers-Danlos syndrome. But I know we're going to talk in a little bit about kind of some newer research and some exciting new developments.
Oh, yes, definitely. And, it's also what we call an invisible illness, because if you look at Katherine and I, we look fabulous.
We look amazing.
We were amazing. And people go, it's hard to believe that we're disabled, that we have a disability. And there is such a thing as hidden disabilities, or, I lead a support group on Sepsis Alliance for people with invisible disabilities from sepsis. And there's also, I'll put a link also in the description box to, it's called the Sunflower Lanyard Program, that if you want to be visible with your invisible illness or your, invisible disabilities, you can wear, they have a lanyard and it has the symbol of hidden disabilities, the sunflower on it. And let me tell you, that comes in handy when I'm traveling by plane, for example. These shoulders, these hypermobile shoulders will not allow me to lift my bag and put it in the overhead. And so by having that, I can look at somebody or the flight crew or someone and say, hey, I need some assistance with this. I have a problem with my shoulders. And then people are really great about it. They're like, oh, no problem, no problem. Plus, it helps educate others about what that sunflower means, because we do need to be identified from time to time, because we do need help.
Right. Absolutely.
Now, the diagnosis part, and Katherine talked about the Beighton score. It's basically things that they have you do, like bending over and putting both palms on the floor flat, how you can bend your fingers, and also I think there were a few other things I forget. It's been almost 10 years now since my daughter's got diagnosed.
Knees.
What's the other one?
The elbows and the knees as well.
Yes, whether they kind of like bend out.
Right, if they bend beyond straight across.
The normal, like the normal degree of bending. So
Yeah.
they call us really bendy, and that sounds like a really good thing, but it's not a really good thing. And again, we're going to get into that. But I took
Right.
40 years to be diagnosed because I showed up with symptoms in my teens. I was basically laughed out of several doctors' offices or told I was, having stomach aches because I didn't want to go to school, which couldn't have been further from the truth.
Yeah.
Headaches, all of that. And then my appendix burst. And,
Oh.
sometimes you'll have organ problems like that when I was 16. So 40 years later, when I'm 54, my daughters, who had better pediatricians and medical care, and I shouldn't say better, I should say that more aware pediatricians, who
Right.
sent them to a genetic clinic in DC at one of the children's hospitals, which was where I went with them. And the doctors diagnosed both of them with hypermobile Ehlers-Danlos and POTS. And then I got my diagnosis of POTS and hypermobile Ehlers-Danlos that way. Katherine, how long did it take you?
Well, I just got my diagnosis. It'll be in July. It'll be 3 years ago
Wow.
for Ehlers-Danlos syndrome, and I was 45.
You were, yeah. So you were older like me.
Yeah.
Not quite as old as me, but you were older.
Yeah. So, I dealt with all sorts of seemingly random health issues and injuries from, I can remember as early as 2 years old, having a sprained arm and doing, having dislocated shoulders from doing cartwheels, getting seemingly, when I hit about maybe like I want to say fifth grade, maybe like 11-ish, I started getting sick all the time. And I was missing a lot of school because of that. And my mom was like, people are starting to question us. Like, are you keeping her home or what's going on? And she's like, no, this is legit. Every time she's sick, we take her into the doctor and they see, no, this is what's going on. I had mono, I had pneumonia, I had, all these different things going on. I started getting migraines. I, just like you, when I was even younger, I want to say 5 or 6, I was having these stomach aches all the time. And to the point where they finally did an upper GI on me. And when that came back normal, they said, she's a very anxious child. This is anxiety.
Oh God, I heard that too. Yeah.
So that was the end of it.
Nerves.
It's nerves. Everything was always nerves, anxiety, hypochondria. And this kind of went on through my teens. And we tried different things, injections for pain. I have a lot of neck and back problems and pain, and migraines and different things like that I deal with and have since childhood. And nothing really helped. And I just felt like they finally just said, oh, you have fibromyalgia, which I felt like was kind of this catch-all of, you're clearly in pain all the time, or at least you say you are. We don't know what's wrong with you, so this is it. And never offered any kind of information beyond that on how to help me or what that meant. And so by the time I would say by the time I was 20, I just kind of gave up trying to find answers. I just was like, I guess this is how I am. And then during my second pregnancy, for the whole, probably half of the second trimester and all of the third trimester, I was passing out all the time. And so I wasn't allowed to drive or anything, which was very hard because I had a 2-year-old at the time as well. And my midwife was just like, it's a vasovagal response. I'm like, okay, what does that mean?
Yeah.
Why is this And that was kind of the end of it. So I just was like, whatever, my body's just weird. And I am a fainter. Yeah. And I now know I've had autonomic dysfunction this whole time too.
Yeah.
And I have a POTS diagnosis. For those who don't know, POTS stands for postural orthostatic tachycardia syndrome, which is a type of dysautonomia, which just means our autonomic or the automatic part of our nervous system that controls things like heart rate, respiration, blood pressure, digestion, all of these things that should happen automatically is malfunctioning. And so that's what that is. So all that to say that it was truly just a fluke, and I myself am a person of faith, and so I don't think it was just a coincidence that I finally got this answer. But I was watching YouTube of all things, and there was just a random video in my feed about Ehlers-Danlos syndrome, and I'm a very curious person. I was like, okay, what is this? I don't know what this is. Started watching it, and by the end of it, my jaw was on the floor because I just was like, holy, I think I have this.
Yeah.
Because I had gotten a Hashimoto's diagnosis a few years before this, and I'm like, okay, that kind of answers, but I feel like there's something more. And every time I would get something, it would be like, but there's some, it's not quite it. And when I started then researching about hypermobile EDS, I was like, this is the first thing in my life that I've ever seen that ticks all the boxes. This makes so much sense. So,
I have
yeah.
Hashimoto's too. I just wanted to add, yeah. But
Yeah,
I'm
there.
sorry, I'm sorry.
No, I was just, I was just gonna say that there are, there's a bevy of these what we call comorbidities, or you know, co-conditions that go with hypermobile Ehlers-Danlos syndrome. And you'd speak to anyone who has hEDS, and the likelihood that they have at least one or two of these is pretty high. So the diagnoses that I've received so far are Hashimoto's, hypermobile Ehlers-Danlos syndrome, POTS, mast cell activation syndrome. In December, I was diagnosed with ME/CFS, which is myalgic encephalomyelitis, and then gastroparesis.
Which is a slowing of your GI tract.
Correct.
Yeah,
Yes.
it
So food
processes
just
your food slower and can cause a lot of pain, right?
causes pain, causes a lot of like bloating. Things just
Yeah.
kind of sit and ferment inside of you instead
The
of moving through.
constipation.
Yeah, all of that. All of
Yeah.
that.
All that wonderful stuff.
Yeah. Oh, and I didn't. My mom was diagnosed with fibromuscular dysplasia, which is a
Interesting.
vascular issue. And so the doctor wanted to check me for it. And while he didn't find evidence of that, he did find that I had another issue with my internal carotid arteries. It's called ectasia, which is kind of like aneurysm, but it's like, you know, the long balloons that like the balloon artists use. It would be like that kind of thing versus like a round aneurysm, like a traditional. So my vessels are just wider, and so I've always heard my pulse in my ears, and that they call that pulsatile tinnitus or tinnitus. And so I'm like, oh, okay. He said, so then the doctor says, it's nothing to worry about. Just know the signs of stroke. I'm like, oh, okay.
It's amazing what we put up with, I gotta tell you. Oh my God.
Yeah. So there's a lot. And so once I figured out, okay, I think I have this, then I started thinking, well, how am I going to get a diagnosis or see a doctor?
Right.
And I generally am good at researching, which is a blessing to me. I also have a background in the medical field, and so I recognize and understand medical terminology, which was also beneficial to me on this search. And I went to the Ehlers-Danlos Society website and kind of just looked through, and I saw that they had a list of providers. So I started looking through. I'm in Minnesota, so I tried to see who, and I found somebody on there who was somewhat near to me, and I called the number and it didn't work. So then I started stalking him.
Yeah.
And
Is he at the Mayo? Because you have the Mayo there, right?
We do, but that's down in Rochester, and I'm in the Twin Cities. So it's about an hour and 15 minutes south of me.
Gotcha.
He's at the U of M, which is also, you know, they have a medical school there where, so this person that I found is actually, he's not a medical doctor, but he's a PhD. I wrote it down here, biochem, biogenetics, physiology, and one of his special interests is hypermobile Ehlers-Danlos syndrome. Yeah. So I reached out to him actually on LinkedIn. I just cold messaged him explained explained who
I
I
found
was.
people on LinkedIn too.
Yeah,
Yeah.
I explained who I was, why I was reaching out to him, and had very low expectations, but was hopeful. And he responded almost immediately to me, and then we
Great.
started chatting, and he was just so warm and so informative, and he's the one who ultimately diagnosed me. We went through the whole criteria, and that's how I ended up with the diagnosis.
What a journey, though. What a journey. And, fibromyalgia is truly a real illness.
For
But
sure.
I'm 63, so I wound up in that era where doctors were telling you had fibromyalgia and literally kind of like, kind of like, yeah,
Yes,
it's a garbage diagnosis. Just tell the woman, usually the woman,
the
that she
hysterical
has this.
woman. Yeah.
Yeah, and it will solve everything or whatnot. And then, I mean, yeah, and I had doctors like, I'm very sensitive to like certain medications, and it's more or less not even the active ingredient. They said in the medications is probably some of the fillers or something, but doctors were trying to literally, I think if they could have blew antidepressants into my mouth, like with a pea shooter or like Tic Tacs or something, they would have done it because this one doctor I used to see, do not see anymore, thank God. He was convinced that I was just, it was mental illness, and he kept trying to give.
Psychosomatic.
You're right, right. Psychosomatic, that I believed I was sick. And he kept trying to prescribe antidepressants for me. And I took the one, and within like 15 minutes or so, I started to get really, really dizzy. And then I started vomiting. That's my party trick is I puke. It's not a
Yeah.
cute party trick, but it's
Yeah.
what I do. And I started vomiting, and I couldn't stop. Like it caused me to just, and so my girls were really little. My youngest girls they were knocking on the bathroom door. My husband was working, my son was helping him, and it was us girls, and they were knocking on the door going, "Mommy, are you okay?" And I
Yeah.
called our pharmacist, and I still have the same pharmacist. We've dealt with the same mom and pop pharmacist for over 30 years now, I think. Or it's been yeah, almost 30. So he was just starting out back then, and I called him and I said, "I took this Paxil and this is what it's doing." And he said, "Well, that is a side effect, vomiting and nausea." And I went, "Well, I got it." And I told him, I said, "I can't get out of the bathroom. My girls are here. One, Alexis, she's a toddler." And he says, "Hang on." And he was about a mile away. He drove up and he brought me
Mm.
flat Coke, ginger ale, saltine crackers, and something else. There was but they literally had like, it was a little box thing of something that was like flat Coca-Cola. He said, "Try this." And it helped. Like the vomiting slowed down, and it got me to a point where I could function and get the girls food and everything. But that was back, yeah, that was back in the day where that one doctor just repeatedly was trying to give me that. And then I did find out, like a few years after that, that my brother had tried a Paxil before, because he had some similar issues, but he was never diagnosed with any of this. And of course they were, "You're depressed, here's a Paxil," which made him so dizzy that he was in the stairwell. He was at the hospital visiting our mom, who was in the hospital. He took the stairs to go downstairs, and concrete stairs in those
Oh,
stairwells in hospitals.
yeah.
He fell down the flight of concrete stairs because he was so dizzy from the Paxil,
Oh
and
my
he
gosh.
had a bruised face. Our mom had macular degeneration; she couldn't see. Thank God that he had this bruised face. And then when he was talking about it later, and I said, "Wait a minute, what's the pill you took?" And he said, "Paxil." I said, "Well, I took Paxil too." And so there are researchers, I think, who are looking into medication reactions, especially according to our genetics. And I'm
Yes.
sorry because I went down a rabbit hole on that topic, but yeah, but again, that's kind of what it's like having EDS and POTS. You are constantly in a rabbit hole of
Yeah.
health problems.
It's
So,
true.
yeah. So you have, Now, did they do anything for your mast cell? And mast cell is, let's also explain, because a lot of people have that. What is
Right.
that exactly?
Well, I'll give you my best understanding since I'm
Yeah.
not a doctor.
Yeah, we are not doctors. Don't take
Right.
medical advice from us. Okay.
Please don't.
Yeah.
Yeah, so our mast cells are a type of immune cell, and they're good. We need them to attack pathogens, get rid of things that don't belong in our body. But with mast cell activation, they're being activated when they don't need to be. And they're attacking things that are not truly a threat. So people with MCAS start developing sensitivities and reactions to things that, quote unquote, normal people, other people don't have issues with. So for one of my issues is histamine intolerance. So I have a very limited diet. I react to so many things. And before I found out that I had that, I would get these horrible migraines and I would just start sweating, like soak through my clothes, sweating from head to toe, go vomit, and then pass out. And, this was a semi-regular occurrence. And I found out, okay, this is histamine overload in your body. And I was also constantly, waking up covered in hives, random hives in different places. Why do I have hives? Or when I get a mosquito bite, for example, it's not a normal reaction. It'll get like this big, a mosquito bite on me. And so just lots of different things. And I get, stuffy. My sinuses are constantly an issue as well. I get stuffy and itchy eyes, all of the things that you kind of think of as allergies, but to just really odd things. Fragrances. I've become a lot more sensitive to fragrances. Like my husband bought, it wasn't even like a strong soap. I think it was like Irish Spring or something. And he had them in a cupboard in another room, and we were sitting watching TV, and it just was so strong, the smell. I could smell it, and it was making me sick to my stomach and giving me a headache. And I was like, what is that? What is that? Finally figured out it was the soap. And he's like, it's in its packaging in a cupboard in the next room, and it was bothering me. And he had to move it to a totally different place. So just stuff like that.
Yeah. The rashes. I get,
Yes.
especially when I was younger, like I couldn't roll in the grass. I wrote about that when I wrote about my Ehlers-Danlos diagnostic journey last year for the Lancet. And I'll put that link too in the description box. But I couldn't roll in the grass as a kid. I was the weird kid who couldn't do that because then I was covered in hives.
Yeah. Yeah. If I just brush against a bush or something, you get what's called dermatographia, where it's like, you scratch your skin and then it will almost very quickly, I don't know if we'll look at it in a minute and see, but it gets red and raised.
But it gets red right away.
Yes.
Yeah.
So, and that's also been kind of since childhood, those types of reactions.
Yeah. Yeah, pine trees, I think, make my youngest daughter react really bad. She was climbing the pine trees with her friends.
Yeah.
And she was, again, covered. I saw that rash. And it's when you see it with your kid and you go, uh-oh. You start to think, because it's like, oh, I've seen that rash before. And sure enough, I mean, are any of your children affected?
So we have not taken them to be officially diagnosed, but knowing what I know, I'm 100% certain that my daughter has Ehlers-Danlos syndrome. She's had signs of POTS and MCAS. And I am almost as positive that my son unfortunately also does. But due to hormones, it's often, and I'm not saying that men can't be as severe, but typically females present with more severe symptoms. And so I think that's why it's just become more obvious with my daughter. And they are both adults. They're 21 and 18. So I've seen kind of with my daughter, speaking of the hives, I remember when she was like a year and a half, 2, And she woke up one day just covered from head to toe in hives. And I thought, what the? But
Yeah.
I didn't put two and two together at that point because I didn't know what I had been what was going on. I just thought, oh, okay, I guess we'll deal with this now.
When we were all in the geneticist's office at Children's, and they had diagnosed the girls, and my son he was in college then, I think, but he was with us. I think he had driven us. We all drove down together, and they also looked at him, and they were like, "So how about you? Are you particularly flexible?" And he was, like, when he was younger, and still to this day, like when he ran cross country, he could do full splits, a full on split as a boy. He was just really, and when they would stretch out in cross country, his legs would literally be like out one way, and he'd be bending over to stretch, and his other legs way behind him. And the coach would be like, "Man, how can you?" But I think it is true that, like a few doctors have said to me, because females, we have so many dramatic hormonal shifts through puberty and pregnancy, pre-menopause, perimenopause, all of that. Our hormones fluctuate, I think, more than male hormones do. And
Yeah.
maybe, who knows? Again, we're trying to get more research, but maybe that's why our symptoms are so much more pronounced. And, in addition to being bendy, because as you heard Katherine describe, it's not just being bendy, it's what all of the defects in the collagen do to the rest of your body, the headaches, the rashes, the hypersensitivities, the gastrointestinal problems. I think there's a couple people I'm following on Instagram who their stomachs are like paralyzed and they have to do tube feeding. And because it is, and that's another thing I want our audience to understand, that it's a spectrum. Katherine and I are both EDS and POTS patients, but we're different, and the severities and everything. And you could have a very mild case, you can have a very severe case, you can have somewhere in between, but it's definitely a spectrum, right?
Correct. Yes.
Yeah. Your son's dental issues, are those related to what you think might be? Because dental issues are another problem with EDS.
Right. So my son's dental issues are actually not related to EDS. It was an unfortunate accident with him. Yeah, he was, I want to say 9, somewhere around there. It was kind of an unusually warm late February night, and we were going to go for a walk after dinner. And he had put on his boots and went outside to kind of see how it was before we were ready to go. And he came back in, and his boots were wet. And we had hard floor in this house. And he saw something, and he went to run, and his feet just went right out from under him. And when he went down, he kind of went right onto his front teeth, and they got pushed right on up. Yeah. And so they got pushed up so high that I, at first, was like, there's a lot of, sorry if you're squeamish, trigger warning. There's a lot of blood. The mouth is very vascular. And so I was kind of trying to see if I could find these teeth because they weren't there. God. Yeah. And finally realized, they're still in there. They're just so high up. He had actually fractured his maxilla. They were pushed so high. So yeah. So that's what happened to him. And it's been a journey from that day forward of working towards trying to get some implants because those teeth had to be surgically removed. They were no longer viable. Yeah. And they were his adult teeth. He had just grown them in.
Yeah.
But the funny thing is my daughter actually does have some issues with her teeth that are EDS related. And when she started growing in her adult teeth, her two front teeth the bottom half of them were missing their enamel. There was no covering on them. And we were just like, what? This is very strange. And they were just she has a very high, narrow palate, which I have that to some degree too. But hers was really bad. So she was seeing this orthodontist and had just gotten braces. And this orthodontist said, when I brought my son in to get what they call a flipper, which is basically like a retainer with some fake teeth just to kind of hold the space.
I used to have one up here. Yeah.
Yeah, so we were gonna get this made, and the orthodontist, he says to my son, you know, it's really too bad this didn't happen to your sister. Her front teeth were already messed up. You had beautiful teeth.
Oh my God. Some
I
of
was
the
like,
things they say, it's like they're
I
trying to
didn't
be
know.
funny, I guess,
Right.
but
I'm sure he
still.
was.
Yeah.
And I mean, I kind of did laugh to myself, but I still was like, this kid's 9.
Yeah.
You know,
Oh my
anyway.
God. Oh
Yeah.
my God. That's what, and Catherine does have a GoFundMe because if any of you know about implants, and I've been going through it myself at the dental school in Baltimore, the implants are very expensive, very expensive. So, and insurances don't pay for it. Even if you could have the best so-called dental insurance, which still isn't good when
Yeah.
it comes to dental insurance. And so I'm going to put the link to her GoFundMe also in the description box to help her son get these implants and get his teeth taken care of because that's a issue that's near and dear to my heart. Catherine mentioned the high palate her daughter has, and I have a high palate as well. That is a marker of EDS, or it's one of the like clinical signs that some doctors will look for. And my teeth had problems with abscesses and everything. And some people have even worse issues where they'll have extra teeth coming in, like, more than 32 teeth, or they'll be missing teeth. And, again, dental insurance doesn't cover like medical insurance does. And many people are going without when it comes to their dental care because it's too expensive and all that. But there are dental issues. If you go on the Ehlers-Danlos Society website, you can also read about that too, and any of the symptoms that we're talking about. I'm going to, go to that Ehlers-Danlos Society website if you think that you also have EDS or a family member has it, and check that website because it's a really great resource and it's exhaustive, I think, in its line of, the listing of the symptoms. And Catherine mentioned too, you can find a provider in your area also on that website. Because that's another problem, right? I mean, there's not many providers at all. It's very hard to find specialists or someone who is EDS aware.
Yeah, absolutely. And I think that in great part, thanks to the Ehlers-Danlos Society's hard work of really getting a campaign of information out to the general public, awareness is beginning to increase. But there's still so much that is not known, and so many doctors, especially if they've been practicing longer, who did not learn about it or maybe got an hour or two out of their entire med school education on it and just really don't understand it. And some of them are wonderful and want to learn and have that mindset of curiosity and wanting to, expand their knowledge. And some just are not interested.
Right.
And don't care to learn about it.
And it's a painstaking process, but like it's taken me more than 10 years, I think, to create the team of doctors that I now have, who are all, aware. They may not specialize, like my gastroenterologist does not, specialize in it, but he knows about it, and he's very well aware of EDS and hypermobility. And I've also found that like physician assistants seem to know a lot, maybe because they're younger and they're just coming out of school, and the physician assistant training maybe tells them a little bit more about Ehlers-Danlos and POTS, but they seem to be very aware. Even if I catch them in the ER, like, and if I get a PA in the ER, they know. They know what it is.
Interesting.
Yeah. Yeah, more than the older MDs maybe. And again, maybe that just has to do with being, more in their training. Ehlers-Danlos, like I said, it's a spectrum, and we're all affected differently. Catherine, and are you doing okay with your neck there too? You'll see us fidget. And I notice it
Yeah,
like
I
right
move it
away
around.
because we fidget a lot to get comfortable. Like I'm
Yes.
sitting on a chair cross-legged right now. And
Right.
I fidget and move and everything when I'm doing these podcasts just so that I can get more comfortable. Are you okay?
I'm okay. Yeah, I'm on the floor actually, leaning
Yeah.
against the footboard of my bed of all things.
Yeah.
So yeah, I'm sure you've noticed me moving around periodically. I'm adjusting, but yeah, it gets tiresome. This is going to sound ridiculous, but for people with EDS, they'll get it. It's hard to hold my head up for a long time. So
Your
I'm just
head's
helping.
heavy. It's a
So I'm just
heavy thing.
helping myself out, holding my head up a little bit, but
Yeah.
I'm good. Yeah.
Well, that's a good time to ask you that question I have about how you compensate. What is it like? How does his EDS alter your daily living? And how do you compensate or work with that?
Yeah. So I have had to give up two careers that have been very important and very, I really have loved because of EDS. I'm a certified surgical technologist, which is for not a lot of people necessarily know what that is, but I'm the person who scrubbed in, set up the cases for surgery, assisted the surgeons, had all the instruments and medications on my Mayo stand, handed instruments, suction, retraction, suture, helping with sutures, that kind of stuff, and I loved it. But you're standing or sitting in one position for a long time, and your arms are out kind of like this a lot, holding things and having to be very still. And I specialized in ophthalmology and oculoplastics, so it's microsurgery. So when you're holding, say, a magnifier on a person's eye for a retina procedure, you have to hold it very still. And I was starting to have issues where I was I was having a lot of numbness and tingling in my hands and my arms. I was losing grip strength. I was exhausted every day. At the end of the day, I had horrible headaches. I finally had to stop doing it. And I went and did get some MRIs done at that point, and I was just in my early to mid 30s at that point, and showed degenerative disc disease, arthritis, some bulging discs, different things. They were like, you have the spine of a 60 or 70-year-old woman. And I'm like, okay. Again, like they just say these things, but then they don't give any help or options. They just say them. I'm like, well, yeah, I've had neck and back pain since I was a teen. And what?
Right. Right.
So I had to stop that career. And then I was blessed to find a job in clinical research where it was less physically taxing, and I actually ended up moving into the quality assurance role in that job, and I loved it. But then the brain fog and the fatigue and stuff, in addition to the pain, started to kind of really push in, and my POTS got worse. And so it was really difficult. It's a very detailed, very important job. You're going through all of the study protocol. You're making sure that everything makes sense. You're asking questions. You're looking at all of the study paperwork, making sure all of the subjects have done what they need to do, that everything is filled out, I's dotted, T's crossed. And for people who don't know, it's not just the physical that exhausts us, it's the mental that is also, it can really exhaust us. I mean, even I'm so delighted to be doing this with you, but this will be the only thing really that I do all day. We have to pace ourselves, and I'm just going to have to like veg out the rest of the day, because just this talking is going to wipe me out.
Same.
Yeah. I know you understand.
I look great doing this podcast, and then afterwards, what I'm going to do today is go to the outdoor pool and put my raging, aching, painful back and joints in the water because I'm done. I can't do anything else.
Yeah. So at this, for a while I was not working at all, but financially this is a huge burden on people too. When, you lose these jobs that are not just a job that I've worked hard and built up my education and worked for years, but they help pay the bills. And I'm blessed because I'm in a marriage, and so my husband also works, but that's still not, it's not enough. So we had to figure something out. So I'm working as front desk, receptionist scheduler at a physical therapy clinic. And the reason I did that was because it's 5 minutes from my house. It's only 3 days a week. I'm sitting for most of the time, but I can get up and move around as I need to. The pay is not, it's a significant decrease from what I was used to earning, but it's better than zero. Right. And so that's kind of where I'm at with that. And even that, honestly, sometimes I start to wonder. I'm on a little break right now for 3 weeks. And I've noticed I have this little wearable device, and I track kind of my exertion, and it gives you like a score when you wake up in the morning. And since I've not been working, I've had a higher score, and it's been more stable, which, right. I mean, what can you do? You understand, you got to do what you got to do to make ends meet, but yeah, it's hard. And then you mentioned the music. So basically right before I got diagnosed with Ehlers-Danlos syndrome, I had finally decided, because I've been a musician my whole life. That's how I met my husband. I joined a band that he was in.
You have the voice of an angel, let me tell you.
Thank you.
And if you guys have not heard that song Disjointed yet, you need to get on after this podcasting. You need to listen to it. But go on.
Thank you. No, I was just going to say, I had kind of decided, all right, my kids are older now. This is my time. I'm going to do this like for real. I'm going to go for it and start writing. And I had, ideas of maybe even doing like some touring or this or that. And then I ended up getting COVID. And that made the pots go from here to here. Yeah. So I am much more greatly disabled by that at this point. And there's just like, there's no way. I look at what you do physically, with your swimming and stuff. And even that, I think, wow, I'm so impressed with that, because for me at this point, that would be really, really hard. Yeah. Yeah. And
that's that spectrum thing.
Exactly.
Yeah.
So there's been a lot of things, and I'm even starting to develop some voice issues, which is just, I'm not going to cry, but it just feels like every time I get to something that I want and I work for, something else kicks in, and then I have to rethink it all over again and think about what I'm going to do next. Okay, I still have so much to give. What can I do instead? And then I go to that, and it's good for a while, but I mean, I'll never stop singing. And I'm sort of looking into seeing a speech language, or like there's voice doctors, voice therapists. And that's also a common thing that can happen with EDS, is having voice issues. Because I'm not going to stop singing. It's like breathing to me. But it's hard, and it's hard to sit down and try to write music when, just sitting at the piano or having the guitar causes a lot of pain. And then the mental fatigue. I feel like I'm being very woe is me, and I'm not trying to be that way at all, but this is the reality.
Absolutely not. Don't even go there, Katherine. If anybody should be saying woe is me all the time, it should be EDS patients, because you demonstrate how resilient and hardworking EDS patients are, and always trying to find, okay, so I can't do this to earn a living. I'll try this, or I'm going to try this. Yeah. And I went through the same thing. I mean, and we are determined. I will say that much. Our bodies won't let us do a lot of the things that we want to do. And, I hope that you can get that help for your voice. Yeah. Because your singing is a magnification of this dreadful thing and what it is. And how did you come up with Disjointed? How did that evolve?
So I went to a songwriting retreat probably in the fall of 2023. And it was right after I'd been diagnosed with EDS, but I was my POTS hadn't gotten as bad because I hadn't gotten COVID at that point. And so it was an absolutely amazing experience. It was people who are in the music industry, who are in Nashville, who just, I ended up having one of the people who ran that become a mentor for me. And so she was kind of helping me. We were just discussing, what do you want to say? What do you want to use your voice for? And this was still a new diagnosis for me. And I'm like, I want to talk about Ehlers-Danlos syndrome. I want to talk about the hidden battle that's going on inside of us all the time. So I just got to it, and it really just kind of flowed out of me pretty effortlessly. The lyrics just kind of came out. I had an idea for what I wanted the sound to be like, and there's very specific reasons for certain instrumentations, representing things like a frazzled nervous system and like a heart beating and different things going on within the song. My husband had got some, not super fancy, but like decent recording equipment. And so we have a room in our house where I can record stuff. And we have our guitars and keyboard and bass and all of that. And he's obviously a musician too.
Yeah.
So I just sat down and kind of worked on it for a while, would record a track, then record another track, add these things. And so most of it is me. I did most of it all on my own. The vocals are obviously me. All the keyboard stuff, the drum tracks, they're programmed. I'm not playing the drums, but but added the drum tracks. I played just like a rhythm guitar track, a few different things, and then I had my husband, his primary instrument is bass guitar, and he also plays regular guitar. So I had him do the bass line and some of the guitar leads.
Yeah.
And then I sent it all of that to a lady in Nashville and had her mix it. And then another person in Nashville mastered it. And then my mentor helped to connect me with a DSP, which is like a digital, now the brain fog's going to start coming in. Digital digital service provider. Maybe if you've heard of something like, I'm really going to, this is in real time. You're seeing what's happening because of the mental exertion. This is what starts to happen.
And you're
and
among friends here.
Yeah.
You're fine.
I'm just, but for people who are watching who don't know, like I feel like such a flake these days because I've always been, doing clinical research and surgery and quality assurance. You got to be sharp. You got to catch stuff. And this brain is not firing on all cylinders anymore. So all that to say, I had wonderful mentors. I had people encouraging me, my goal, I was talking to the mentor in January of 2024, and my goal was to have this released during Ehlers-Danlos Awareness Month of that year, which was May of 2024. So
I was going to say 2 years ago, right? Yeah.
Correct.
Okay.
So from the time I had this conversation in the beginning of January till it was written, recorded, mixed, mastered, and released, I did that. I did all that in 4.5 months.
Yeah.
And it just was meant, I think it was just meant to be because, like I said, it felt very effortless. It just kind of flowed out.
It's haunting. It's a haunting song. It's you poured all of yourself and your struggles into that song. Comes through loud and
Thank
clear.
you.
Very loud and clear, and it's a beautiful song. And I've been listening to a lot of smooth jazz lately just because I've had to tune out a lot of stuff. And I always go, smooth jazz is my default when I don't want to think about anything.
Yep.
I got to get back because your song is on my Spotify playlist, so I got to get back on there. But yeah, I mean, you'll find yourself singing along, and if you have Ehlers-Danlos, you'll totally understand. Like that song gets you. It gets all of us. So yeah, and it's on Spotify. It's here on YouTube. Is it
It's
anywhere
on,
else?
yeah, it's on Apple Music, it's on Amazon Music, pretty much Pandora, anywhere that you can stream, it's
Oh,
available.
Pandora's got it too.
Mm-hmm.
Okay, that's
Yep.
that's the channel I use for my smooth jazz. So okay,
Ah, yeah. Yep.
all right, awesome, awesome. And then I wanted to talk a little bit about people who are listening, watching, and going, I think I have that, or I do have EDS, and I can't seem to get it through to my doctor how much I'm suffering. Do you
Mm-hmm.
have, like, besides the one that you went to see, the doctor do you notice if there are more EDS aware doctors in your area? Like, I'm definitely picking up on that here in Central Maryland,
Mm-hmm.
that there's more.
So I guess I would differentiate between EDS aware and EDS literate.
Okay. How so?
So what I mean by that is you can mention it and they might be, oh yeah, I know what that is. But I would suggest digging a little deeper when they
Yeah.
say that to make sure they really know what that is, because a lot of doctors just think, oh, it just means you're extra bendy. And that's kind of where it ends.
Yeah.
They don't
That's
really,
not it. Yeah.
yeah, and they don't fully grasp the gravity and the all-encompassing issues that it brings. So as far as in the Twin Cities, there's groups like in Facebook. I'm sure they're for all over the place, but I'm part of a Minnesota and Twin Cities Ehlers-Danlos group on Facebook. And so, people can kind of share on there. I'm looking for a neurologist. I'm looking for this. Who do you guys see? And
Physical
so
therapist.
physical therapists are
Those
huge.
are big with us. Yeah.
Yes, because I mean, I don't know about you, but I've been injured by physical therapists who don't understand
Right.
hypermobility well. And
Same.
so,
Yeah.
yeah, so it's very important that you find someone that knows about our specific needs with our bodies. I still think one, other than just word of mouth and trying to find people in your community who are dealing with similar issues through groups like this Facebook group, and Instagram is where you and I met.
Oh, yeah.
There's just so many.
There's a
There
lot of us there.
there's a lot of resources if you are able to kind of dig in.
Yeah.
But I really think that honestly, the best resource still is the Ehlers-Danlos Society webpage,
Yes.
and that list that they have, and they're adding to it all the time.
Yes, they do update it. Yeah.
But you really, and it's so frustrating. I will say it's very frustrating that we have to be our own advocates in such a major way when we're the ones who are so suffering. Like, it's the last thing you want to do when you're exhausted, when you're in horrible pain, when you're just looking for help, and you have to be the one to push, 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 push. But
Yeah.
it's so imperative. You have to advocate for yourself, and that's something that I've learned is that you don't have to be a bitch, but
Yeah.
you
But
but
sometimes you do.
sometimes you
You
do.
have to be a nice bitch. You have to be
Yeah.
a nice bitch. That there's a difference.
Well, that's like Minnesota nice, right? It's really Minnesota passive aggressive. But
Right. Yeah.
but I just think if you are going to a doctor, well, first when you're calling, I would say mention Ehlers-Danlos syndrome right off the bat and kind of read that reaction of, are they, because some doctors want nothing to do with it.
Yeah.
Why? There could be a million different reasons. Maybe they think it's the flavor of the month because it is
Right.
getting more.
There are still some doctors who doubt it and don't really think it's a big deal.
Right. That
Yeah.
could be one reason, or they just don't want to be bothered to have to do, they have enough going on. They have enough patient load with various other things. It's just not something who knows. But so just kind of read that reaction. And if they seem like they kind of are either they know about it or they're willing to learn, which is huge.
Yes.
So that would be something to look for when you're trying to find a provider. And then I would say know before you go what specifically you want discussed and what you want found out, what kind of testing you think you might need or want. And you can ask their opinion, but if they're kind of dismissive, or if they try to steer it in a different way, like, I don't really think, you have to be able and willing to kind of push back on that and say, well, I hear what you're saying, and be respectful, because no one's, everyone wants to be spoken to respectfully, right? And so speak to them respectfully, but also assertively. And I strongly recommend, if you don't think you'll remember, write it down before you go, because you can get flustered, especially depending on the provider and how they present. They might fluster you or make you kind of lose what you're going to say. And two, if you can, bring someone with you, a friend, a family member, someone who's going to help advocate for you, who will remember things that you might not, and who will also be able to remember or write down what the doctor is saying to you, because in that moment, you might not remember everything that was discussed either.
Yes, that's so important. I mean, and because I do appreciate, like I said, the team I have now, they're phenomenal. And my GP is, oh my God, she is chef's kiss. She is like 1,000 out of 10. And she's a PA, and she listens. She is proactive with me, being a sepsis survivor. Like any little hint of an infection, I had this implant site opened up the other day, very minor, but they did open the tissue and put some stitches in to find the screw and put the healing cap on. And I got antibiotics, just to make sure. And when I go in there, I return the favor, so to speak, by, as Katherine said, I have a list. You could keep a list in your phone. I prefer to handwrite. I'm still kind of old school that way, so I'll take my little trusty pad that I have right here, and I write everything down, so that when I sit down with her, I know she has other patients to see, especially general practitioners, and I just go through my list. And, okay, Marilee, I got this, I got this, I got this, I got this. And I've gotten out of there in like less than 15 minutes. I got it down to a science now. But their time is valuable, and they will really appreciate you if you come in prepared. And, because the brain fog, as Katherine said, is real. Write everything down before you get in the doctor's office.
Yeah, absolutely.
Yeah. And, and in general, too, I think, like as Katherine said, to look on the Ehlers-Danlos Society's website for providers in your area, to try to find, if you're just trying to get that diagnosis, or you're just trying to find out, more, find providers who are going to understand what you're going through, and communicate that very clearly with your doctors, and hold your ground when, if they are, as Katherine said, if they're steering you in another direction, it is okay and respectful to say, well, I can see why you think that, but this is what I think it really is.
Yeah.
The research, we had talked about that in the beginning. There is some new research. There are some new developments. The wheels are turning slowly, but they're turning. What have you been reading about? Anything?
Yeah, I'm a huge science nerd, so I love to read like PubMed studies and do the deep dives.
MedSpeak today is good too. Yeah.
Yes. So I won't I won't put your viewers to sleep doing too much of the nerdiness, but
I'm a nerd too, so it's cool.
But there is a place called the Norris Lab, which is out of the Medical University of South Carolina, and they have a team that is specifically researching for Ehlers-Danlos syndrome, and I think that they are doing research for multiple different types, but I know they're doing a lot of research for hypermobile Ehlers-Danlos syndrome, and just really trying to find those biological markers. So we can find something like a simple blood test or urine test or something that we can definitively say, okay, you have X, Y, and Z. Yeah, you've got this. And then just make it easier for diagnosis. But some of the things that I'm finding fascinating and that just makes so much sense are they're starting to figure out that it's maybe not, and when I say just, I don't mean to diminish people who have various types of connective tissue disorders like Marfan syndrome, for example.
Which is related kind of to, yeah.
Yeah,
Yeah.
but they're starting to notice that maybe the connective tissue and collagen defects are actually not the thing, but they're a response to the real root.
Thing.
Yeah,
Yeah.
and so they're starting to look into immune and inflammatory markers and something called the complement system, which is part of your immune system. There's the innate immune system, and then there's the complement system. And I'm not going to pretend that I fully understand the difference at this point, but they're starting to think, okay, we've noticed some things in people's blood with hEDS diagnosis, hEDS diagnosis, that are different, and they were consistent in people in these studies that they're running, that show differences in immune function, in inflammatory response, in blood pressure regulation, in blood clot differences. And so it feels like a very promising, very exciting time for our community. It feels like people are really getting to the root causes, and like I think we're gonna see some real answers in the next few years. I'm very hopeful anyway. And then there is also new diagnosis criteria coming out the end of this year in December 2026. So the last time that criteria was updated was in 2017. And it was great compared to what there was before that. However, some people who actually probably do have hEDS were not meeting that criteria and were kind of slipping through the cracks. And also some people who maybe actually have something else going on were getting the diagnosis. And so we're hopeful that this new diagnostic criteria is really going to be more honed in on the true syndromes going on with the community, that people are going to get diagnosed more quickly, more easily, and more reliably.
Right. Right. Because a fast diagnosis is great, an accurate diagnosis is even better. And that's, yeah, so that's definitely some of the things that are coming down the pike here with the research. And I think, making sure that we get people, because it's kind of still classified as a rare disease. But again, I know so many people. Like, I was in the locker room at the YMCA one time, and I'm talking, and I was telling another woman about having Ehlers-Danlos syndrome, and another woman, young lady, actually over a couple of locker banks down, hears me because I talk quite loud, and she yells out, "I think that's what I have," and she comes running over, and she was showing me, her level of bendiness and telling me about her other symptoms and problems, and I was like, wow. So even like I meet people with EDS. I gave a talk at a meeting 2 months ago, and there was one of the organizers at the event had EDS. So I know it's a thing, and she mentioned I think there's a support group, even an in-person one, it might be here in the DC area. So it's, again, they call it rare, but I know a lot of people it feels like, and maybe Instagram makes it feel too, like I know a lot of people with EDS, but.
Right. I mean, maybe, but I have similar experiences. I had at the clinical research facility that I worked at, I had a coworker, and she and I, before either of us got our diagnosis, we used to talk, and well, she was saying something, and I was like, oh, I deal with that too. I totally get it. And she's like, you do? And she was shocked because no one ever really understands what she's going through. And we used to just commiserate. And then I hadn't seen her for a little while because she had to step back for a while from work.
Yeah.
We both went back. We were there for our CPR training, updated CPR training. And I said, I have to tell you something after we're done with this. And she's like, okay, I do too. And we both got a diagnosis of hypermobile Ehlers-Danlos syndrome. And we're like, no way. And she's like, I knew it. I knew you had it too, because we both just had so much in common. Yeah.
It is that aha moment. It's like, I knew that's what it was.
Yeah.
Or even, certain people, if you're just sitting, I go to a party somewhere and talking about some of my health problems, and someone else will clue in, and they're like, Ehlers-Danlos? do you have Ehlers-Danlos? It's like, really, So,
Yeah.
yeah, I think it's definitely getting the PR, the long needed PR that it needs and should have been getting for a while. Has Let's end on a very positive note. Has EDS affected you, or your struggles with EDS impacted your life in a positive way?
Yeah, I can think of a few different things that have been a positive result. For one, getting to meet amazing people like you, Jackie, and
Same.
it's been such a pleasure and such a blessing to get to know so many people who get it. And I think when you deal with chronic illness of any kind and chronic pain of any kind, it it creates a level of compassion and understanding in you that I would not trade, because I feel like it helps me to view other people in a much more gracious way. And I'm grateful for that. And I wouldn't want to change that.
Truly. I echo your thoughts on that too. It's made me a lot more compassionate, empathetic. I get it. Even if I'm standing in a long line and you finally get up to the counter, and instead of wanting to berate the poor person behind the counter, you understand, and it makes me even more than ever want to make that person feel better, because they often feel bad too because they have a long line and people are waiting.
Yeah.
And you want to say something to make them feel better. And I always say that I like to make people smile. If I've made you smile, then I accomplished my goal. And I could be in my most incredible pain ever. But I still, it's like we were talking before I hit record on this podcast. I'm an absolute mess. Some days my life is a shit show. And I get on these podcasts and hit record and go, hey, hi, everybody. Hi, here I am. And now after this, Catherine is going to go rest, and I'm going to go
be like,
rest. Yeah, we're going to just die after this. But I am so glad I got to talk to you in real time finally after all these years of communicating on Instagram. This has been wonderful. I hope to get out to Minnesota one day and see you, because it's tremendous. Like, I met a sepsis survivor in person last fall when I was in Boston giving a speech, and that was like the absolute best. It really is about our communities. That's what's keeping us sane, I think.
100%. Yeah, in fact, you gave me a quick peek kind of ahead of time of what your questions were going to be, just so I had a little idea. And I know your last one was, any words of wisdom.
Yes.
Maybe I'm jumping ahead, but
no. That's you read my mind. I'm gearing up. We're gonna fly on out of here, and Catherine is gonna give us the last word on wisdom.
Yeah, it's you kind of gave me the perfect segue, because really my words of wisdom would just be: find your community, find your people. And if you are not able to do that physically because of limitations, for all the trouble that social media causes, it's a wonderful conduit for creating community and for finding people like yourself who really can understand in a way that others can't what you're going through, the good, the bad, and everything in between. And my other word of wisdom would just be: keep a sense of humor as much as you can. Just laugh.
Laughter through tears.
Yes, exactly. Laughter through tears. I myself have kind of a warped, twisted sense of humor, which I also feel like develops in this community.
Yeah. My doctors really, they're like, oh my God, she's out there.
Right, she's lost it.
Yeah.
Yeah. But it's just so important. It's so important because, you can get bogged down in the day-to-day crap, but there's still so much to be joyful about and so much to be grateful for. And so much of that has to do with the people that are in our community and the people around us.
Yeah, our community. We're where it's at. Yeah. And you can find Katherine on Instagram, like I said. And are you on Facebook too? Do you have a page on?
I mean, I do, but it's more just like my personal Facebook page. Okay. It's not public.
Instagram is where it's happening.
Okay? Yes. Yeah. For me anyway.
So you can find us on there. And don't forget about her music, of course, and signing up to her YouTube channel and, listening to that wonderful song. And always remember that these podcasts are for fun, entertainment, and information purposes only. And if you think you are having an episode of a crisis with sepsis, perhaps, or if you think you have EDS and everything, go see your doctor. Okay, call 911 if you're in a sepsis crisis. Don't rely on us, okay? There are medical experts out there you need to contact, and this isn't where it's at. So anyway, thank you again for listening, everyone, and watching, and for supporting this podcast. Like I said, it's here to give rise to all of our voices and make those connections. Sepsis, chronic illness, disability, and the whole kit and caboodle. So anyway, signing off for today. Thanks for listening. Katherine, thank you for being my wonderful, lovely guest today. It's been a real pleasure, and we will see you guys next time.